So to do the lymphatic massage, we will always do it before breastfeeding because we're trying to move fluid away into your lymph so that your milk can come out while you're breastfeeding or expressing. Today, we're going to talk about lymphatic massage. Lymphatic massage for breast engorgement is a technique to help alleviate discomfort and reduce fluid engorgement in the breast during breastfeeding. I find that this skill is particularly effective when you have reduced flow of milk due to fluid engorgement. Now, engorgement can occur as your milk is coming in, usually from about day 2 to day 5 after birthing baby. Now, some women experience the feeling of engorgement because of breast fullness as milk is coming in. Your breast will feel heavy, sore, maybe a little bit lumpy or quite hard, but the flow of your milk is not reduced and it doesn't affect your breastfeeding experience. If this is the case for you, you probably do not need to do the lymphatic massage straight away, but it's still good to know the skill of it and when to incorporate it into your breastfeeding routine. If you, for example, accidentally slept too long and woke up feeling really sore and notice reduced milk flow, or if you're starting to feel a lump in your breast that is not softening at all after feeds and you're starting to feel some swelling and extra tenderness on your breast, it's good to incorporate this lymphatic massage and do it for a day or two before every single breastfeed to see if it helps clear any signs of plugged duct. Now, fluid engorgement compared to normal engorgement will make you feel like your breasts are really tight, like the skin of your breast may feel stretched out and that there's really not much move to your breast in general. Not only will you feel the firmness of your milk being heavily stored in your breast, there's also going to be an additional layer of tightness and swelling on top of your breast, like a swollen ankle. This extra bit of swelling may significantly reduce the flow of milk coming out, although you feel like your breasts are really full. For example, if you're trying to express breast milk with a pump, you might notice that your breasts feel rock hard, but not much milk is flowing out, or you're not getting much relief after expressing. This is probably because of the extra layer of swelling on top of your breast that's making you feel full and uncomfortable, and it's in a way affecting the flow of milk that's coming out. If this is the case for you, the lymphatic massage will help reduce the top layer of swelling and to increase the flow of your milk as it's coming out. So please keep on watching if you need to learn this skill. You might also experience more engorgement or severe fluid engorgement if you've had a long labor, if you've had lots of fluids through a cannula during labor, or if you are usually quite prone to, say, ankle swelling during pregnancy, and so that a similar kind of swelling may pull on your breast as your milk is coming in. You can also be more prone to swelling from decreased mobilizing after giving birth or infrequent breastfeeding for the first few days after birthing baby. So to do the lymphatic massage, we will always do it before breastfeeding because we're trying to move fluid away into your lymphatic system. So the closest lymphatic system to your breast is probably going to be your armpit, and we're going to try to move the top layer of swelling away so that your milk can come out while you're breastfeeding or expressing. Keep in mind that this is not lymphatic drainage, so we're more doing things on the surface level to temporarily give you relief. It doesn't last forever, so you will need to do it before every single breastfeed if you're getting some engorgement. And the swelling will come back quite quickly after we do this massage. Now, the pressure for this lymphatic massage is very gentle. It should not cause any discomfort, and it's not a massage designed to knead the knot so that the knot softens, because there's no deep muscles in our breast causing this kind of discomfort, and there's a lot of delicate glandular tissue, and all the alveoli is working really hard, maximized at its capacity to try to produce a lot of milk. So any deep tissue massage will cause significant discomfort and potentially cause plugged duct and close off your ducts down the chain. Now imagine you're stroking a kitten that's like literally this big. So really gentle pressure. Trust me, a little goes a long way with this massage. To demonstrate on a piece of dish mat, this is the amount of pressure. Not like this, not rock hard. Imagine the pressure you use when stroking your baby's hair. We're going to use a flat surface and not fingertips or knuckles. You would not be stroking your baby's head like this. So don't do that on your breast, please. And to use my very engorged balloon, for example, very gentle pressure. If I was to put more pressure, the balloon will make a squeaky sound. So that's too much pressure. The direction of this massage is the most important. So as I've mentioned previously, we're going to massage away from your breast, not towards your nipple, because we're trying to move swelling away so that your milk can come out. We're going to gently stroke towards your armpit. And then we're going to circle this way and around your nipple, and have a long, gentle stroke all the way towards your armpit. You want to use a flat surface and not sharp fingertips or not your knuckle on your breast, because that's going to hurt. If you're doing any deep tissue massage, not only is it painful for you, you also won't see any bruising or swelling come up on your breast until a day or two later. Because your ducts are so fragile and squished with engorgement, it can also cause actual blocked ducts by you doing a really hard massage. Try not to have any bra that's too tight, or probably don't wear a bra at all, because you don't want anything causing any dents on your breast when there's a lot of fluid engorgement. So with the massage, I want you to do it for a minute or two until you feel like the top layer of your breast is a little bit squishier. That's a sign that we've successfully moved some swelling away from your breast. If you try to hand express after this, you might notice that you'll actually see a few drops of milk coming out and that the flow is not as reduced after the lymphatic massage. If the milk flow is not as fast as you would like it to be, or you're still seeing signs of reduced flow, or if your baby is really having trouble latching on this engorged breast and tends to latch a lot more shallower compared to usual, you might need to also do a reverse pressure softening before breastfeeding baby. My next video is going to be on reverse pressure softening, so if the lymphatic massage by itself is not working for you, please also try reverse pressure softening before breastfeeding your baby. Usually fluid engorgement gets a little bit worse before it starts to get better. It's really a matter of commitment and doing it before every single breastfeed to help milk flow as well as the swelling to go away. So using ice packs or those breast gels for 10 to 15 minutes after every single breastfeed is a great therapy you can do in combination with the lymphatic massage to quickly help the swelling go away. It probably will take anywhere between 24 to 72 hours. So keep persisting, you can do this. Let me know in the comments if this lymphatic massage helps you, or send it to your friends if they're experiencing any signs of mastitis or any swelling on their breasts. Thank you so much for watching, and I will see you in the next video. Bye!